Any condition in which the blood pressure is below 90/60 millimeters of mercury is known as low blood pressure. And this blood pressure is a force in which the blood exerts on the walls of the blood vessels in order to pump blood adequately to supply the entire system in the body. And when this blood pressure is low, it will be difficult for the organs and various tissues in the body to receive an adequate amount of blood to perform its various functions. What is considered low blood pressure in one individual might not be low blood pressure in another, in the sense that no two individuals' blood pressure is the same. There are some individuals that naturally that their blood pressure is on a low side. This low blood pressure can be of different types. We have orthostatic hypotension. A situation when an individual will notice a drop in his or her blood pressure, either when standing, lying, or sitting down. When an individual has a change in position, you will notice that such an individual's blood pressure will be dropped. When this happens in an individual, it will be termed low blood pressure. And what can trigger this orthostatic hypotension can be either due to pregnancy or some medications or any injury or change in health condition, like especially for someone that has autonomic nervous system disorder. These are some individuals who might have a drop in their blood pressure when there is a change in position. Another one is postprandial low blood pressure. In this postprandial, it occurs 1 to 2 hours after eating in an individual, especially those people who are at risk of having some Parkinson's diseases. These are some individuals that will have a drop in their blood pressure. Blood pressure can vary throughout the day depending on the time of the day that blood pressure is being measured. Like, it might rise in the morning, while usually at night the blood pressure is usually on a low side. There are some certain signs and symptoms that an individual might be presenting that will give such an individual a clue to check his or her blood pressure, because extremely low blood pressure can be disastrous to the body system. It can cause damage to especially the brain and the kidneys. It can cause damage to such organs when not properly managed. Then if you are manifesting some signs and symptoms like fainting, dizziness, blurring of vision, and fatigue, even some stomach upset, please, you are advised to check your blood pressure, because there are some warning signs of low blood pressure. There are some medical conditions that can cause low blood pressure, such as pregnancies, due to pregnancy hormones. Pregnancy hormone will cause the blood vessels to widen, and when the blood vessels widen, it will cause a drop in the blood pressure, because the force at which the blood pumps the blood to be reduced. Then another thing is medications. There are some antihypertensive medications that will cause a drop in the blood pressure. Please, you are advised to check with your healthcare provider to know which medications that will cause a drop in your blood pressure, especially antihypertensive, anti-Parkinsonism drug, and antidepressant. Even there are some diuretics that cause a low blood pressure. Please check with your healthcare provider. Again, dehydration, low volume of fluid in the body, because our blood needs fluid to perform its function. When someone is dehydrated, the blood pressure will also be low. Another point is blood loss. When there is blood loss, like a hemorrhage, you will notice that the rate at which the heart pumps blood to our various organs will be affected, thereby bringing a drop in the blood pressure.